The pandemic putting a strain on healthcare workers, from staffing shortages to exposure to COVID. For hospice workers, they're even further exposed in a patient's home. But as Fox 5's Lauren Martinez reports, they are needed in person.
Certified nursing assistants help patients in their home.
We're their voice when they can't speak. We're the ears that when they need someone to listen to. And we're there at their most vulnerable moments.
We've seen the strain of staffing shortages and the impact COVID-19 has had on healthcare workers in hospitals, but rarely do we hear from those literally at someone's bedside.
So we go on, we bathe them, or we help them with meals, we do vitals. It's so much. Sometimes they got to get up and they just want to do a little walk in their room. Sometimes we help them walk and just because they've been laying in the bed and no one's there.
Beltran, a CNA, has been there for hospice patients for nearly 20 years in Vegas. She goes from home to home 5 times a day.
They probably don't know that we sit there and sit with them and hold their hands or wipe their tears or give them positive words.
Medical Director for Southwest Medical Hospice, Dr. Lisa Rosenberg, says RNs and CNAs are exposed to people the most.
Being in a person's space means something very different than it did 2 years ago.
She hopes people will understand these healthcare workers cannot do their job remotely or even through telehealth.
It is a scary thing for us who go home to families that we, parent. If we have younger staff and their parents live with them, I have my kids. It's scary for everybody right now. And I think it's an opportunity for everyone, our team and our patients and their families, to all think about showing compassion to each other.
I'm their friend. I'm like a family member that they don't have.
In Las Vegas, Lauren Martinez, Fox 5 News Local, Las Vegas.
And Southwest Medical Hospice workers are required to wear PPE inside of a household if a patient or a family member was exposed to COVID.